How old are you? How long have you been living with diabetes? If you are taking metformin to manage your blood sugar, have you ever wondered if it is truly safe for your kidneys? Millions of people with type 2 diabetes believe that metformin is their only option for controlling the disease. But what few people tell you is that this drug can negatively impact kidney function over time. Some studies have warned that if your kidneys are already compromised, metformin can make the condition worse, increasing the risk of kidney failure. The good news is that you don't have to rely on metformin forever. There are natural alternatives that can effectively manage blood sugar without harming your kidneys. Have you ever heard of berberine, a science-backed, safe alternative? Let's explore this now. 1. Concerns about metformin's impact on the kidneys. Metformin is one of the most commonly prescribed medications for type 2 diabetes. Known for its ability to lower blood sugar by improving insulin sensitivity and reducing glucose production in the liver. However, growing concerns about the long-term effects of metformin on kidney function, especially in people with pre-existing kidney issues, have emerged. One of the biggest risks associated with metformin is the accumulation of lactate in the body, which can lead to lactic acidosis, a rare but dangerous complication that can cause kidney failure and damage other organs. The kidneys play a crucial role in filtering and eliminating toxins from the body. When kidney function declines, the ability to remove lactate is impaired, increasing the risk of toxicity and organ damage. Additionally, metformin may contribute to oxidative stress, a condition where excessive free radicals attack cells and damage tissues. The kidneys, already vulnerable due to diabetes, can be severely impacted when oxidative stress levels rise. This increases the risk of diabetic nephropathy, a common complication in long-term diabetes patients. Some studies suggest that while metformin is effective in controlling blood sugar, if kidney function is not regularly monitored, it can silently damage the kidneys over time. That's why doctors often recommend that patients with moderate to severe kidney impairment reduce their dosage or discontinue metformin to avoid unwanted risks. The problem is that many patients are not fully informed about this risk when they start taking metformin. They may not recognize early warning signs such as fatigue, nausea, shortness of breath, or muscle pain, which could be linked to lactic acidosis. If left undetected, this condition can lead to acute kidney failure or even death. The good news is that there are safer alternatives for managing blood sugar that do not harm kidney function. Learning about these options can help you protect your kidneys while effectively controlling diabetes. 2. Kidney damage and diabetes. Diabetes not only affects blood sugar but can also cause serious kidney damage. One of the main mechanisms leading to kidney damage in diabetes patients is oxidative stress, a condition that occurs when there is an imbalance between free radicals and antioxidants in the body. Free radicals are unstable molecules that can damage cells, proteins, and DNA. When free radical levels become too high and the body lacks enough antioxidants to neutralize them, oxidative stress occurs, increasing the risk of tissue damage and inflammation. For diabetes patients, oxidative stress attacks kidney cells, gradually impairing kidney function. One of the most severe consequences of oxidative stress in diabetes patients is diabetic nephropathy, a chronic complication where small blood vessels in the kidneys are damaged due to prolonged high blood sugar levels. When kidney filters are damaged, protein can leak into the urine, which is an early sign of declining kidney function. If not managed properly, diabetic nephropathy can progress to end-stage kidney disease, requiring dialysis or a kidney transplant to sustain life. Additionally, diabetes leads to blood pressure changes and altered blood flow to the kidneys, worsening kidney damage. High blood pressure, a common condition in diabetes patients, can increase pressure on kidney blood vessels, accelerating kidney deterioration. Another factor contributing to kidney damage in diabetes patients is the accumulation of advanced glycation end products, AGEs. When blood sugar levels are high, sugar molecules bind to proteins and fats in the body, forming AGEs. These compounds not only increase oxidative stress but also trigger inflammation, further damaging kidney tissues. The biggest issue is that diabetic kidney disease often has no noticeable symptoms in the early stages. Many patients don't realize their kidneys are deteriorating until function has significantly declined. That's why regular kidney function tests, such as glomerular filtration rate, GFR, and urine albumin tests, are essential for detecting early signs of kidney damage and taking timely action. The good news is that you can slow down or prevent diabetic kidney disease by controlling blood sugar, managing blood pressure, and reducing oxidative stress. Strategies such as low-carb diets, antioxidant supplementation, regular exercise, and avoiding processed foods can help protect your kidneys from diabetes-related damage. 3. Other medications that can support kidney health. Besides metformin, some other medications have been studied and proven to protect kidney health in type 2 diabetes patients. Among them, SGLT2 inhibitors, sodium glucose cotransporter 2 inhibitors, like Jardiance, empagliflozin, and Farxiga, dapagliflozin, are becoming increasingly popular. These drugs not only help control blood sugar but also offer significant benefits for kidney health, particularly in those at risk of diabetic kidney disease. How SGLT2 inhibitors work on the kidneys. SGLT2 inhibitors work by blocking glucose reabsorption in the kidneys, allowing excess sugar to be excreted through urine. This reduces the burden on the kidneys, as less glucose needs to be processed, minimizing kidney damage caused by high blood sugar. Research also suggests that Jardiance and Farxiga can slow the progression of diabetic kidney disease and lower the risk of kidney failure. In addition to their kidney protective effects, these drugs offer cardiovascular benefits, reducing the risk of heart failure and stroke, two common complications in diabetes patients. As a result, many doctors now prefer prescribing this class of medication to diabetes patients at high risk of kidney or heart disease. Side effects of SGLT2 inhibitors. While these medications provide many benefits, they also come with some potential side effects, including urinary tract infections, since the drug promotes glucose excretion through urine. Bacteria can thrive, increasing the risk of infections. Women are generally more susceptible than men. Dehydration. As the body eliminates more water to remove glucose, patients may experience dehydration and low blood pressure, leading to dizziness, fatigue, or fainting. This is especially dangerous for older adults. Increased risk of fractures. Some studies suggest that Farxiga may reduce bone density, increasing the risk of fractures, particularly in those with existing bone issues. Diabetic ketoacidosis, DKA, a rare but serious condition where the body produces excess ketones, leading to blood acidity. This can occur even when blood sugar levels are not extremely high, making it difficult to recognize the danger. Who should and shouldn't use SGLT2 inhibitors? These drugs are recommended for type 2 diabetes patients at high risk of kidney failure, but they are not suitable for everyone. Patients with a history of recurrent urinary infections, low blood pressure, end-stage kidney disease, or bone disorders may need to reconsider before using them. Doctors typically monitor kidney function regularly when patients are on these medications to ensure that kidney function remains stable. If significant kidney decline is detected, the medication may need to be discontinued or replaced with another treatment. Conclusion. While Jardiance and Farxiga can help protect the kidneys and benefit diabetes patients, they are not a perfect solution. Patients should understand the potential side effects and monitor their kidney health closely. In many cases, controlling blood sugar through diet and lifestyle changes remains the best way to protect kidney health from diabetes-related damage. 4. Berberine, a natural alternative to metformin? When it comes to blood sugar control, metformin is often considered the gold standard. However, growing research suggests that berberine, a natural compound found in plants like goldenseal and barberry, may offer similar benefits without the side effects of metformin. Berberine has been used in traditional medicine for thousands of years to aid digestion, reduce inflammation, and manage diabetes. How does berberine work? Berberine lowers blood sugar by improving insulin sensitivity, reducing glucose production in the liver, and activating AMPK, adenosine monophosphate activated protein kinase. AMPK is often referred to as the master switch of metabolism, helping the body use glucose more efficiently and thus lowering blood sugar levels. This mechanism is similar to how metformin works, but berberine has a major advantage. It does not deplete vitamin B12 or increase the risk of lactic acidosis like metformin. Another unique benefit of berberine is its ability to support heart and kidney health. It can lower LDL, bad cholesterol, increase HDL, good cholesterol, and reduce inflammation, which is crucial for diabetes patients at high risk of heart disease and kidney damage. Some studies have also shown that berberine reduces oxidative stress and protects kidney cells from diabetes-related damage. Dehydroberberine, the optimized version of berberine. Although berberine has many benefits, its biggest drawback is poor absorption. When ingested, only a small portion of berberine actually enters the bloodstream, reducing its effectiveness. To solve this issue, researchers developed dehydroberberine, an improved form that absorbs 5 times better than regular berberine. This allows patients to achieve better blood sugar control without requiring high doses of traditional berberine. Dehydroberberine also has a longer-lasting effect in the blood, helping maintain stable blood sugar levels throughout the day. More importantly, it causes fewer digestive issues, one of the most common side effects of berberine. This makes dehydroberberine an excellent alternative for those who cannot tolerate metformin or want a more natural way to manage blood sugar. Why don't more doctors recommend berberine? Despite extensive research proving berberine's effectiveness in blood sugar control, most doctors are not familiar with it. The main reason is that berberine is a natural compound and cannot be patented, meaning pharmaceutical companies have no financial incentive to research or promote it. In contrast, metformin, a synthetic drug, generates massive profits for the pharmaceutical industry. Additionally, traditional medical training focuses heavily on prescription drugs rather than natural solutions. Unless you consult a functional medicine doctor or a natural health practitioner, you may never hear about berberine from your doctor. Both berberine and dehydroberberine offer a safe and effective alternative to metformin, especially for those looking to control blood sugar without the risk of kidney damage. However, because it is a natural solution, you must take responsibility for your own research and monitor your health carefully. If you are searching for a sustainable way to manage diabetes without relying on pharmaceuticals, berberine could be the answer. 5. Key compounds for kidney protection. Diabetes significantly increases the risk of kidney damage due to oxidative stress, inflammation, and prolonged high blood sugar levels. To protect the kidneys from these harmful effects, experts recommend certain compounds with antioxidant, anti-inflammatory, and kidney-supporting properties. Among them, alpha-lipoic acid, ALA, benfotiamine, vitamin D and vitamin B complex are top choices for maintaining kidney health naturally. 1. Alpha-lipoic acid, ALA, a powerful antioxidant. ALA is a strong antioxidant that helps protect the kidneys from oxidative stress, which is one of the main causes of kidney damage in diabetes patients. When free radicals accumulate and overwhelm the body's antioxidant defenses, kidney tissues suffer severe damage, increasing the risk of diabetic nephropathy, diabetic kidney disease. ALA not only reduces oxidative stress but also improves insulin sensitivity, naturally lowering blood sugar levels. Additionally, ALA reduces inflammation and protects small blood vessels in the kidneys, preserving kidney function in the long term. Studies have also shown that ALA can help relieve diabetic neuropathy symptoms, a common complication of diabetes. 2. Benfotiamine supports sugar metabolism and kidney health. Benfotiamine is an enhanced form of vitamin B1, thiamine, with superior absorption and greater effectiveness in protecting the kidneys from high blood sugar damage. When blood sugar levels are too high, they combine with proteins and fats to form advanced glycation end products, AGEs, compounds that trigger inflammation and kidney damage. Benfotiamine reduces AGEs formation, protecting kidney blood vessels and reducing inflammation. It also supports better glucose metabolism, helping diabetes patients maintain stable blood sugar levels. Some studies have shown that benfotiamine may lower the risk of kidney failure in patients with prolonged high blood sugar levels. 3. Vitamin D supports kidney function and immune system. Vitamin D plays a critical role in kidney health, especially for diabetes patients. The kidneys are responsible for converting vitamin D into its active form, which supports bone health, immune function, and metabolic processes. However, when the kidneys become damaged, their ability to process vitamin D declines, leading to severe vitamin D deficiency. Studies suggest that vitamin D supplementation can reduce kidney inflammation, improve kidney function, and protect against oxidative stress damage. Additionally, Vitamin D enhances insulin sensitivity, helping manage blood sugar levels and reducing the risk of kidney complications. 4. Vitamin B complex helps prevent anemia and protects nerves. Vitamin B complex, including B6, B12, and folic acid, B9, is essential for kidney and nerve health. In diabetes patients, high blood sugar damages small blood vessels in the kidneys, leading to anemia due to decreased red blood cell production. Vitamin B6 and B12 boost red blood cell production, improving blood flow to the kidneys and preventing kidney tissue damage. These vitamins also protect the nervous system, helping reduce symptoms of diabetic neuropathy such as numbness, tingling, and pain in the extremities. Folic acid, vitamin B9, helps lower homocysteine levels, a compound linked to heart disease and kidney damage. High homocysteine levels in diabetes patients accelerate kidney function decline, so folic acid supplementation may slow down this process. Diabetes can severely damage the kidneys, but supplementing with ALA, benfotiamine, vitamin D and B complex can help maintain kidney function, reduce inflammation, and fight oxidative stress. Combining these nutrients with a healthy diet, regular exercise, and proper blood sugar control is the best strategy to protect the kidneys from diabetes complications. 6. Kidney Protection Guide for Diabetes Patients. Diabetes can cause severe kidney damage if not managed properly. However, you can protect your kidneys and slow down kidney function decline by following scientific and practical strategies. Here's how you can maintain kidney health while living with diabetes. 1. Strict blood sugar control. Keep fasting blood sugar between 80 to 130 mg per deciliter to minimize kidney damage risk. Avoid high-carb and sugary foods. Monitor your blood sugar frequently. 2. Eat a kidney-friendly diet. Leafy greens reduce oxidative stress. Berries contain anti-inflammatory anthocyanins. Nuts provide healthy fats, low in carbs. Fatty fish, salmon, mackerel, rich in omega-3 for kidney protection. 3. Avoid smoking and stay active. Smoking reduces kidney blood flow, worsening damage. Exercise improves circulation, reduces blood pressure, and enhances insulin sensitivity. 4. Regular kidney function tests. Glomerular filtration rate, GFR. Creatinine levels. Urinary albumin test. By combining diet, exercise, and monitoring, you can protect your kidneys and avoid complications from diabetes.